So my name is Laurence Albiges. I'm a medical oncologist working in Gustave Roussy in France. With regard to the question of what is the significance of the data we've presented here at ASCO 2024, it is important to stress that in the adjuvant setting, as of now, we have standard of care pembrolizumab for patients of intermediate or high risk of relapse. The IMmotion010 data did not demonstrate atezolizumab increased disease-free survival over placebo, but it was used as a data set for exploratory analysis of circulating biomarker. And it is the first time we are reporting such analysis. What has been conducted in the study is a two-step process, the first one being to screen for the circulating protein that would be differentially expressed between baseline post-nephrectomy and at time of recurrence. And KIM-1 stand out. KIM-1 is kidney injury molecule 1, clearly stand out to be highly expressed at the time of disease recurrence. So it could be a good biomarker because it is accessible both in plasma and in the blood. And we knew from other studies that it could play a role as a prognostic tool, and we confirm indeed that high KIM-1 baseline patient had worse disease-free survival, meaning that those patients were more likely to have disease recurrence. It is meaningful because that could help us to define the strategy on should we go for adjuvant therapy in some selected patient based on biomarker. It needs further validation, but it is an important piece that is coming after prior report, which already showed that KIM-1 had a prognostic value. On top of that, we demonstrate the predictive value of this biomarker, as high baseline KIM-1 patients were more likely to derive benefit of atezolizumab treatment. Although this drug is not approved, it is important to stress that there is a rationale to use KIM-1 as a potential predictive biomarker, and hopefully this will be further validated. So not only we have demonstrated that baseline KIM-1 high level was associated with poor disease-free survival, or worse disease-free survival, but what is interesting is that for all patients we had cycle 4 day 1 on treatment KIM-1 assessment. So that allows to have a dynamic tool. And what we report is that increase in KIM-1 was associated with worse disease-free survival. It means that this biomarker could be a monitoring tool for us to follow patients after surgery. So right now, it is important to stress that it needs to be further validated, but the increase in the circulating biomarker depicts the fact that the patient is likely to have disease recurrence, and this is the information we're capturing. So our finding should not be taken to routine practice tomorrow. It requires prospective validation of the biomarker. But it is the third trial to demonstrate the prognostic value of circulating KIM-1. It has been the case in the prior ASSURE trial. It has been demonstrated in the CheckMate 914 nivolumab plus ipilimumab study, and now we are demonstrating it in the IMmotion010 trial. So very consistent signal on the fact that this biomarker could be the right biomarker, and hopefully one day to help to detect which patient should receive adjuvant therapy, we hope. So what is needed is a further validation of this study in a prospective trial. But I really believe that given the past 2 trials which highlighted the role of KIM-1, it's likely that this circulating biomarker can now be taken into consideration for building a prospective study.